Good morning, Mr. President. Thank you for listening. My name is Gerard Freisinger. I am a physician with 40 years of practice and have thought about healthcare reform for a long time. Several issues come to mind, and I think the present plan that you have and the direction you're going is wonderful, but it does not go far enough in that it still provides fee for service. I believe a outcome that is less expensive and still maintains quality of care has to do with salaried providers. Obliteration of Medicare, Medicaid, and private insurance companies, as well as malpractice. Providers are salaried through an income tax, and that salary is negotiated between specialty societies and the government, with no more than a 20% fee differential between high and low risk specialties. All patients in the area of where this trial is conducted are treated for free. There is no insurance, no Medicare, no Medicaid, and there is no malpractice. There are regional ombudsmen comprised of retired providers as well as laymen who will field complaints about subpar physicians and other providers. A mechanism such as the automobile licensing is developed in which points are given for subpar performance, leading to license revocation. Any outcomes that do not come out as they should are paid for through a slush fund, also provided through the income tax, which would be there because the lack of motivation from a non-fee for service would be much less than is presently the case. What I see now is happening is that high-tech proceduralists are looking for reimbursement. Once they see that CMS reimburses for a procedure or a test, they will buy the equipment, and every patient is put through this test whether they need it or not. An article recently posted in the New Yorker shows the difference between the cost to Medicare in McAllen, Texas versus the cost per patient in Medicare in the Mayo Clinic. The cost is twice as much in Texas as opposed to a salaried state-of-the-art medical facility in Rochester, Minnesota. I would welcome a discussion on universal health care provided through salaried providers with the elimination of all of the parasitic baggage that exists from insurance companies, coders, and billers, and all the rest. Also, pharmaceutical companies would have to be dealt with by the federal government, and the costs of pharmaceuticals put more in line with the cost in other countries, that this country does not subsidize the research and development for drugs so that other countries can benefit. For those who say this is a totally socialist system, I invite you to read an article in Health Affairs 5 years ago by Katz, who actually looked at the number of Canadians that came over to this country for medical care. The number is very small. Anecdotes are present on both sides. I can also tell you of people that go to Canada for LASIK surgery and India for bypass surgery, where the costs are much cheaper. The long waiting lines that are feared would not be the case in this country, which is rich in equipment with MRIs and PET scanners and radiation equipment and all the rest compared to Canada or to other countries. I hope such a system could be developed on a regional basis, say a state or a number of counties, and then compared in a period of 5 years in terms of outcome, provider satisfaction, patient satisfaction, and cost with the control which is going on in the rest of the country. Thank you very much for listening.